the injuries that happened are definitely disabling injuries. I mean, we went on rounds with experts, plastic surgeons, reconstructive surgeons who were there on missions as well. These are completely disabling injuries. I mean, at best, if you're lucky, you might just limp a little bit. You're talking about major blood vessels, bone shattering, and muscle waste. I mean, we had people who the wounds were starting to heal if they've been shot in their heels, but there's actually no heel. So maybe the wound, their skin is healing, but there's nothing to walk on. So you're talking about each case, you're talking about at least 6 to 7 times returns to the operating room. You're talking about increased risk of infection. That's why we had also the infectious disease specialist from Augusta, Victoria. We had actually we thought we had saved a limb of a young man who we saw the first day in the ICU. He was in fact gasping for life because the staff were so overwhelmed, they were actually sedating everyone to perform the dressings. The dressings were so painful. You're talking about opening dressings 2 days post-injury with major injuries. And so after sedating this boy, he was basically gasping because he couldn't breathe very well. It depressed his breathing. And later we found out his hemoglobin was something like 7. So later in the night, our vascular surgeon managed to do vascular surgery, and the family was so happy. They even came to thank the surgeon, and he was awake, and we thought for that patient we had made a difference. Unfortunately, after we left, our mission was there for 6 days, we get a phone call and realized that an infection started setting in, and the infection later caused a bleeding in his artery, and they had to amputate his leg. And it gives you pain as a health professional because you go in with the intent to help, and you think you've done your best, and then you start wondering, should we have stayed? But then how long do you stay, and how many missions are needed? So when you said, what does it say? The surgeons in Gaza have some expertise. They were able to do what they could do. The amount and number of injuries was something horrendous that nobody could cope with. You're talking about more than 1,000 injured in a span of 2 to 3 hours. I mean, you almost need like a national triage system to be able to manage this anywhere in the world. And although they managed to do some kind of triage to different hospitals, but having severe injuries, you need severe expertise in war traumas. And people try to save lives at the beginning. And then after that, you start thinking about saving limbs. And it's very sad because it is ongoing. 2 of the surgeons with me said, this is very depressing. When I said, why? I thought first just their initial reaction. And they said, it's depressing because we know that each of these young men will have to go back to surgery 7 or 8 times maybe even, and over 2 years maybe, because it's not something just for dressings, it's for reconstruction, it's trying to see how they can do a bone graft, a skin graft.